Hello, this video will detail our research reviews about ultrasound as an intervention modality for physical therapy. We will provide evidence supporting the ineffectiveness of ultrasound. You'll hear from 3 student physical therapist assistants from Naugatuck Valley Community College and 1 student of the Movement Science program from Westfield State University. My name is Susie Garino, and my teammates are Evans Amo, Octaviana Williams, and Scott Weiss. Up first, we have Evans, who will begin with a large-scale meta-review.
Hello, my name is Evans Amo, and I'll be talking about the ineffectiveness of therapeutic ultrasound as a modality in rotator cuff disease. And the points I'll be discussing is from a 2016 Cochrane's database of systematic review, a beta analysis for electrotherapic modalities for rotator cuff disease by Page, MJ, Green, S, and Carly. And this beta analysis had a sample population of 23,888 participants with rotator cuff disease across 47 trials with an average age of 53. They tried to find out if ultrasound can effectively control pain and improve functional mobility. The interventions utilized was ultrasound, TENS, low-level laser therapy, and pulse electromagnetic field therapy, which was administered alongside exercise for a 3-week period, totaling 10 sessions. The findings revealed that when ultrasound is used alone, it did not result in significant improvement in pain or range of motion compared to other modalities, but had a short-term benefit when combined with other physical therapy agents. So to conclude, it did suggest it is not effective as a standalone treatment, but may offer additional benefits when integrated with other interventions. Next, we have Octavina. Thank you.
In assessing the impact of continuous, pulse, and sham ultrasound treatments on carpal tunnel syndrome. In my study, there were 54 patients. There was also 3 groups: continuous ultrasound, pulse ultrasound, and sham ultrasound, all wearing wrist splints. The outcome measures for clinical, the parameters were pain, hand function, and strength. For the ultrasonographic measures, they used the median nerve area. The study's results showed that continuous, pulse, and sham ultrasound had showed improvement after 2 to 6 weeks. However, though, there were no significant long-term ultrasonographic changes. The splint was applied to all groups, but it may have contributed improvements. While ultrasound treatment shows beneficial offers, it is not suitable for long-term solution for carpal tunnel syndrome. Next up, we'll have Susie, who will make another comparative point.
In the Egyptian Journal of Hospital Medicine in 2023, Maha Arafa Ali conducted a study called Comparison Between Therapeutic Ultrasound and Laser Therapy in Treatment of Plantar Fasciitis Diagnosed by Ultrasonography. They had 56 patients divided evenly into 2 groups. Group 1 received laser therapy, scanning method 808 nanometers, irradiated in 3 points over 3 centimeters squared, for 9 minutes 3 times weekly for 2 weeks only. Group 2 received ultrasound therapy at 3 megahertz, 20% duty cycle, 0.5 watts per centimeter squared, for 8 minutes 3 times weekly for 4 weeks. Both groups did have significant improvements compared to their baseline. The beneficial results were similar 4 weeks after treatment. Their laser therapy was slightly more effective. However, that disparity in their effectiveness was more significant at 8 weeks. Therefore, laser therapy had not only better, but also longer lasting results compared to ultrasound, with a shorter treatment time. With efficacy and efficiency in mind, ultrasound is comparatively ineffective. Lastly, we hear from Scott, who explores DOMS.
Hi, I'm Scott, and my article was Ultrasound versus Sham Ultrasound for Experimentally Induced Delayed Onset Muscle Soreness, a double-blind randomized control trial by R. Parker, PhD, and V.J. Madden, Bachelor of Science from 2014. They induced delayed onset muscle soreness in 20 female patients ranging from the ages of 18 to 25, and they observed them for 3 days over a time of which they had 2 treatments done. The most statistically significant data found was after the first treatment and before the second treatment, where they noticed an increase in range of motion in the sham ultrasound patients, while noticing a decrease in range of motion in the active ultrasound patients. This leads to the question of that if placebo is able to compete with ultrasound in results of the treatment, then why are we using that therapeutic ultrasound in that method when nothing could be cheaper than doing something?